Hi, we're back with the continuation of our assessment. Next, we are going to check cranial nerve number 2, which is the optic nerve, and we check that by using a Snellen eye chart, and we don't have a Snellen eye chart available, but what it is there's 11 lines, and there's letter E's on the line, and you check the visual acuity by having covered one of the patient's eye, and you have them try to read whatever line they can, and that checks for the cranial nerve, and you'll check both sides, left and right. And then you would check next, you would cover your patient's eye. Okay, go ahead and cover your eye with your, there you go. And you check their, you'd have the patient tell you when they can see movement. Okay? Okay. All right. And so cranial nerve number 2 is intact. And then next we will check cranial nerve number 8. And this is the whisper test. So you have the patient cover their left ear, and you whisper something in their ear, and you see if they can hear you. And she was able to hear what I whispered. And you would do that on both sides. We're only going to check one side. Liz does hear appropriately. Next, we're going to check cranial nerves 9 and 10, the hypoglossal vagus nerve. And by this, you check the uvula. So you have them open their mouth. Okay? Put your tongue down. Swallow for me. And she does have a gag swallow reflex, and that is appropriate. Next, we'll check number 12. Stick your tongue out at me. Move it from side to side. Okay, good. Smile. All right. And the final part of this is we'll have them, the patient stand up, and we will do the Romberg test. And when the patient does the Romberg test, we will, you want to brace them, close your eyes, okay, and you note the gait, any swaying or, okay, go ahead and open your eyes, you can sit down, and Liz did have a little bit of a sway, which is normal for everyone, sways a little bit. You're looking for a gross abnormal swaying one way or the other with the gait. Okay, that concludes the eyes, ear, nose, throat, and the cranial nerves. Now we're going to move to the checking the back, and you start by palpating the scapula, and you want to go from a right to a left, and you're just palpating, making sure there's no abnormalities, and you want to feel, palpate, look. And next you want to take your stethoscope, and you want to palpate with your stethoscope, auscultating from left to right using the diaphragm of the stethoscope. And you're going to listen to the lung fields. You're going to listen to the bronchovesicular lung field. And you want to start at the top of the clavicle. And have the patient taking a big breath. And out. Okay. Again. Okay. And you're listening for lung sounds if there's any abnormalities like wheezing, rales, rhonchi. Next, you want to move to the bronchovesicular, which is right down below. And you want to listen from right to left. And you're listening for bronchial, which is breath sounds right there, and that is at the main stem of the bronchus, and then below that is the vesicular sound. So you want to listen with your stethoscope again using the diaphragm, and you want to go below, okay, the main stem there, and you want to auscultate from right to left, or you could do from left to right, whatever is your choice. Next, you want to check the apical pulse of the heart using the stethoscope, using the diaphragm. So you want to locate the heart, and she's got a good S1, S2 noted. Next, you want to auscultate using the bell to check. You want to palpate for the base. First, we'll do palpating the base of the heart. You want to use your palm of your hand. You find the heart, and you palpate. And next, you want to turn your palm to palpate the bottom of the heart, at the base of the heart. Next, we're going to go back to using the stethoscope. You're going to use the bell. Using the bell of the stethoscope, you want to auscultate the different quadrants of the heart. You want to palpate or auscultate the aortic valve. Then you want to go to the pulmonic valve.